The top stories tonight in Y News. The Philippine government's negotiation on COVID-19 vaccine with Western pharmaceutical companies will push through. The palace made this clarification after President Rodrigo Duterte took a swipe at pharmaceutical firms of Western nations.
Wala naman po epekto yan. We continue to negotiate with everyone as in fact the President wants to ensure na magkakaroon tayo ng vaccine kahit sino pang unang makadevelop niyan.
A Filipino infectious disease specialist believes the study of UK experts that face masks could give people COVID-19 immunity. The same infectious disease specialist advises people to avoid getting sick while we wait for a vaccine against SARS-CoV-2.
Authorities reiterate that Metro Manila residents traveling to provinces even nearby are still required to present travel authority. The Joint Task Force Shield COVID emphasizes that tourism in Tagaytay City is limited only for the people of Cavite.
Guidance pa rin National Task Force is that kung hindi ka apor at ang lakad mo hindi related dun sa work mo, hindi pa rin tayo pwedeng lumiban. Lalabas tayo ng probinsya. So that yung galing sa Metro Manila, pagpupunta ng Cavite, dapat po may reason ka na pagpunta doon. At kung hindi, dapat kukuha ka pa rin ng travel authorities.
The PhilHealth officials facing charges following a task force PhilHealth report to the president cannot evade trial. Health Secretary Francisco Duque III was not among the officials the president mentioned, who will face raps for the PhilHealth mess. But Malacanang said investigations will continue.
Senate President Vicente Soto III disappointed that Health Secretary Francisco Duque III was not included among the officials found liable over the alleged anomalies in PhilHealth.
Economies across developing Asia will contract this year for the first time in nearly 6 decades, but recovery will resume next year, according to an Asian Development Bank report. Good evening, Philippines and the world. Today is Tuesday, September 15, 2020. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am Mariel Latoza.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am Marvi Delphine.
First in the news, the Philippine government's negotiation on COVID-19 vaccine with Western pharmaceutical companies will push through. Our Malacanang correspondent, Rosalie Cos, tells us why.
Wala naman po epekto yan. We continue to negotiate with everyone as in fact the President wants to ensure na magkakaroon tayo ng vaccine kahit sino pang unang makadevelop niyan.
Malacanang clarifies the Philippines will continue its negotiations on coronavirus vaccine with Western pharmaceutical companies. This includes the country's participation in the Gavi COVID-19 Vaccine Global Access or COVAX facility. The COVAX facility is led by Gavi, the Coalition for Epidemic Preparedness Innovations, and the World Health Organization, in partnership with developed and developing country vaccine manufacturers. The palace made the clarifications after President Rodrigo Duterte took a swipe at pharmaceutical firms of Western nations. The chief executive said he will not pay the reservation fee, which is against the Philippines procurement law.
Pero kung sabihin mo na, sige, wala pa yung vaccine, there is nothing with finality, and you want us to make a reservation by depositing money, you must be crazy. Hindi ako bakit ako bili ng ganong style because the procurement law of the Philippines, this country, does not allow you to buy something which is non-existent or to be produced as yet.
According to the president, there are some pharmaceutical companies asking fees for their vaccine research and development.
Like in other countries, they want cash advance bago tayo deliver ng vaccine. Kung ganon, patay tayong lahat. Every Filipino will die. I can assure you. Why? Kung wala tayong ibigay sa kanila cash advance, di walang vaccine. That's one thing wrong about the Western countries. It's all profit, profit, profit.
Thus, he vowed to prioritize buying COVID-19 from Russia and China as long as theirs are effective and good. Russia has offered the Philippines joint production of its vaccine, while China has also committed priority access for the Philippines on the vaccine it will develop. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
A license to operate has been granted to Valenzuela Hope Molecular Laboratory located in Dalanda, Valenzuela City. It is owned by the city government of Valenzuela. Now the laboratory can perform independent testing for COVID-19 by real-time PCR. The license is valid from September 12 to December 31, 2020. The molecular lab is expected to abide by the highest laboratory quality standards and participate in the proficiency testing program of the Research Institute for Tropical Medicine, or RITM.
The Philippine National Police Academy extends its lockdown period until the end of September. Meanwhile, activities of its cadets have been limited. Our police correspondent, Leah Ilagan, tells us why.
The PNPA, or Philippine National Police Academy, has recorded 243 positive COVID-19 cases among its personnel and cadets. Almost 200 of those are freshmen or from class 2024. 9 are from class 2023, 8 from class 2022, and 37 from class 2021. The confirmed coronavirus cases in the PNPA also include 11 personnel, of which 2 are officials. The PNPA recorded its first COVID-19 case in July. Aside from preparing 6 buildings to be used as isolation facilities, the PNPA administration has also increased the supply of vitamin C and face masks for its cadets. PNPA Director, Police Major General Gilbert Cruz thanks those who have helped them on the needs of the cadet corps in this time of pandemic.
So far, kontrolado naman kasi for almost 5 days. Minomonitor na namin yung everyday yung kalagayan ng mga nag-positive sa academic. Even yung mga persons under monitoring natin.
Also, the PNPA lockdown has been extended until the end of September. No visitors are allowed.
We limited yung mga activities nila like yung exercise nila na everyday jogging sila paikot ng kampo. Medyo ngayon, ang ginagawa nilang nila, mga self-imposed exercise na ginagawa nila sa kanilang mga dorms. So, minomonitor na lang namin kasi kailangan magpalakas din sila eh. Hindi ba pwedeng puro tulog ang gawin nila?
Leah Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
A Filipino infectious disease specialist believes the study of UK experts that face masks could give people COVID-19 immunity. Our health correspondent, Aiko Miguel, will join us tonight to tell us why live. Yes, Aiko?
Yes, Harleen, the Department of Health stated yesterday they are further studying whether face masks could give people COVID-19 immunity. Dr. Ron Zinsolante, an infectious disease specialist, explains that it is possible for people to have COVID-19 immunity by wearing face masks, especially in communities. Such study was also published in the New England Journal of Medicine. UK experts explain that immunity is the ability of an organism or an individual to resist a particular infection or toxin by the action or protection of antibodies. Here's Dr. Solante's explanation.
Evidence that face masks, all of us who wear face masks, see no transmission of infection in the community. So indirectly, the face mask protects the individual, and that in itself is defined as immunity against the infection.
Dr. Solante adds that if there is a small number of COVID-19 infections in a community, transmission will be less. He also explains what herd immunity is all about. Dr. Solante emphasizes when a community wears a face mask, although there is a positive case who does not protect himself with a mask, it is less likely for the rest of the community to be infected with the virus. Again, here is Dr. Ron Solante.
You have 20 people in one room wearing face masks, and you have one individual there who will be coughing. All of you are protected, so nobody will be transmitting the infection because you did not acquire the infection because you're wearing the face mask. So you get the immunity because shield coming from the face mask.
Meanwhile, DOH spokesperson Undersecretary Maria Rosario Vergeres said yesterday non-pharmaceutical interventions is not enough. Here is Undersecretary Maria Rosario Vergeres.
But I don't think that non-pharmaceutical intervention can boost your immune system to give you that immunity. Baka ito lang yung talagang preventive measure that can really work, no? Itong combined preventive measures of wearing face mask, wearing face shield, doing physical distancing and hand washing para tayo ay makaagapay hanggang wala pang bakuna and we can live with the virus.
Hurling, the DOH has always been reminding the public to boost the immune system through proper and balanced diet and intake of vitamins, plus exercise and sufficient water intake. Dr. Solante also advises the public, while there is no vaccine yet, it is important to avoid getting sick. This should come with refraining from drinking alcoholic beverages and smoking, keeping a safe distance away from symptomatic patients, and even suspect cases of COVID-19. Again, here is Dr. Ron Solante.
You have to keep yourself healthy, aside from the health protocol, no? Healthy in a way, yung exercise, don't drink. Kung meron kang hypertension, may diabetes ka, drink your medication regularly. Based on our patients, mga smokers, taas ng mortality, no? Kasi smokers, because their lungs are already inflamed, doble ang inflammation, mas lalong severe.
Hurling, the public should understand that because there is no cure yet for COVID-19, it is part of the new normal to wear a face mask and the face shield, to observe physical distancing, and to wash hands regularly to avoid catching the virus. Hurling.
Aiko, can you also share to us the other contents of the UK expert study you mentioned in your report?
Yes, Harleen, to test their hypothesis that population-wide masking is one of those strategies they need to further study, comparing the rate of asymptomatic infection in areas with and areas without universal masking. They also believe ultimately, Harleen, combating the pandemic will involve driving down both transmission rates and severity of disease. Increasing evidence suggests that population-wide facial masking might benefit both components of the response. Harleen.
Thank you so much, Aiko Miguel, for that report.
Authorities reiterate that Metro Manila residents traveling to provinces, even nearby, are still required to present travel authority. Meanwhile, the Interagency Task Force has approved the recommendation made by the Department of Tourism to allow staycation in general community quarantine areas. Joanne Nano tells us why.
As the provincial government of Cavite reopens tourism in Tagaytay, City Governor John Vic Remulla still discourages the public travel to Tagaytay for leisure purposes. This is due to a high risk for COVID-19 infection because of its cold weather. Joint Task Force COVID-19 Shield Commander Police Lieutenant General Guillermo Eliazar also clarifies that people coming from Metro Manila who are planning to go to Tagaytay City are still required to secure travel authority. He also emphasizes that tourism in Tagaytay is limited only for the people of Cavite and not for Metro Manila residents.
Ang guideline pa rin National Task Force is that kung hindi ka apor at ang lakad mo hindi related dun sa work mo, hindi pa rin tayo pwedeng lumiban. Lalabas tayo ng probinsya. So that yung galing sa Metro Manila, pagpupunta ng Cavite, dapat po may reason ka na pagpunta doon. At kung hindi, dapat kukuha ka pa rin ng travel authorities.
Meanwhile, the Interagency Task Force has approved the recommendation made by the Department of Tourism to allow staycation in general community quarantine areas. The DOT is still in process of drafting the policies on the opening of hotels for staycation. However, this will cover only DOT-accredited accommodation enterprises located near a staycationer's residence. For instance, a person living in Metro Manila will be allowed to spend a staycation only in hotels within Metro Manila, subject to the local government's COVID-19 protocols. The Metro Manila mayors and the MMDA met on Sunday night and agreed to re-allow staycation. However, they wanted to identify which hotels will open since many hotels are still being utilized as quarantine facilities.
Papayagan naman yung staycation pero hindi pwedeng magsama ang positive of quarantine places staycation. That's why we need to identify which hotels are allowed and not allowed.
Joanna, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the country's Department of Health says that over 3,500 new cases were reported today, raising the total confirmed cases of coronavirus infection in the Philippines to 269,407. The National Capital Region logged in the most number of new patients with 690, followed by Cavite with 305 and the Rizal Province with 201. The total active cases increased from yesterday, now at 57,392, of which 87.9% are in mild condition, while 8.0% are asymptomatic. We have lost 34 more patients. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 395 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to more than 207,000. Thanks be to God.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of almost 29.3 million confirmed cases in 188 countries, regions, and sovereignty. The fast-spreading disease has claimed over 928,000 lives, while close to 19.9 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God.
The PhilHealth officials facing charges following a task force PhilHealth report to the president cannot evade trial. A lawmaker even suggests to place them on the Bureau of Immigration's watch list. Dante Amento tells us why.
President Rodrigo Duterte has approved the recommendation of Task Force PhilHealth to file criminal and administrative charges against some PhilHealth officials. These include resigned PhilHealth President Ricardo Morales, Senior Vice President Renato Lim Tiangco Jr., Senior Vice President Jovita Aragona, OIC Calixto Gabuya Jr., Senior Vice President Israel Pargas, Executive Vice President and Chief Operating Officer Arnel De Jesus, and Division Chief Bobby Crisostomo. Based on the result of the task force investigation, the officials are involved in graft practices and malversation and failed to file withholding taxes in connection to the Interim Reimbursement Mechanism or IRM. President Duterte says those PhilHealth officials will undergo trial for them to prove their innocence.
The issue of PhilHealth and corruption was really an important issue to the Filipinos and to everybody. And everybody, again, is also placed in jeopardy by the actions of the officials. I'm sorry for them, but they would have to undergo trial. Although they can always prove their guilt beyond reasonable doubt. Pula man namang ano pa yan. The presumption of innocence still attaches. But the report of another agency says otherwise. So, ganun ho ang nangyari sa PhilHealth. Halos lahat sa board.
Justice Secretary Leonardo Guevara, who leads the task force, has earlier said their composite team will continue their investigation. Meanwhile, in its official statement, PhilHealth discloses it is waiting for the official copy of the task force report to the President. The state insurer vows to follow the President's decision and to continue cooperating on the task force composite team investigation. Meanwhile, Bagong Henerasyon Party List Representative Bernadette Herrera asked the Justice Department to place PhilHealth officials facing raps on the immigration watch list and issue whole departure order against them. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Health Secretary Francisco Duque III was not among the officials the president mentioned who will face raps for the PhilHealth mess. But Malacanang said investigations will continue. Our palace correspondent Rosalie Cos tells us why.
Task Force PhilHealth submitted its report to President Rodrigo Duterte yesterday. Among its recommendations is to strongly admonish and remind the chairman and members of the board of PhilHealth of grave consequences of their action or inaction on the PhilHealth Fund. In particular are the negligence on the ratification of the Interim Reimbursement Mechanism or IRM, the approval of its Information and Communications Technology or ICT procurement, and the failure to investigate and prosecute those who committed fraud in the agency. Last night, President Rodrigo Duterte publicly named the officials recommended to be charged criminally and administratively. The Health Secretary's name was not mentioned, but Malacanang says that Health Secretary Francisco Duque III is not yet absolved from the anomalies.
This is only the beginning, no? Nakasaad din po sa report na magpapatuloy po ang investigasyon ng NBI at ng DOJ at magpapatuloy pa rin po ang mga investigasyon ng Ombudsman.
Also, according to the palace, aside from Duque, there are other cabinet members who are also sitting as ex-officio members of the board of directors of PhilHealth. Negligence is also somehow mitigated by the active concealment of vital documents and information by some members of the executive committee from the board of directors. The palace further says what severe admonishment means for the chairman and the board members.
Kinakailangan pagsabihan ang chairman at ang members of the board, including 5 cabinet members, na kinakailangan mas matindi ang kanilang pagbabantay sa pondo ng kaban ng bayan nang hindi po nawawala sa mga ganitong paraan.
Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
Following the recommendations made by the task force led by the Department of Justice to President Duterte, Senate President Vicente Soto III says he was disappointed that Health Secretary Francisco Duque III was not included in the officials found to be liable in the alleged anomalies in PhilHealth. According to Soto, he was dumbfounded upon knowing that Duque and PhilHealth Senior Vice President for Legal Sector Rodolfo Del Rosario were not recommended by the task force for the filing of criminal and administrative charges. As the PhilHealth's chairman of the board, Duque is one of those recommended by the Senate Committee of the Whole, headed by Soto, to face criminal charges due to malversation and violation of the Anti-Graft and Corrupt Practices Act for the illegal and improper implementation of the controversial interim reimbursement mechanism, or IRM, of PhilHealth. Soto adds, luckily the Ombudsman has the power to initiate its own investigation and does not rely on task forces. But for Senator Kiko Pangilinan, the exclusion of Duque from the recommended filing of charges is no longer surprising, noting that the list of corrupt and what he calls incompetent untouchables under the current administration is getting longer. The senator adds condoning corruption and illegality will only lead to more corruption and incompetence. Meanwhile, Senator Risa Hontiveros says it was bewildering that despite the findings and the recommendations of the Committee of the Whole, Secretary Duque was let off the hook. The lady senator believes in order to clean up PhilHealth, the government has to go after the big fish. However, the palace says the health secretary is not yet absolved of possible liabilities over the alleged anomalies in PhilHealth. Presidential spokesperson Secretary Harry Roque says the task force will continue with its investigation.
Those displaced workers due to the coronavirus pandemic, or perhaps you know someone who is. The Office of the Vice President has launched a portal called seekup.ph. Vincent Arboleda will tell us why.
More than 140,000 Filipinos in the private sector have lost their jobs, according to a Labor Department report in August. To help displaced workers find jobs, the Office of the Vice President has launched the Bayanihan program. With the help of Elevatech, an online job platform was created called seekup.ph. Here, companies can post job vacancies where job seekers can apply. Anyone looking for work just needs to register using their Facebook and Google account or their email address. A resume can also be uploaded to the site. There are currently more than 6,000 job postings at seekup.ph, like positions for online tutors, call center-related jobs, operation managers, graphic artists, and technicians. Vice President Leni Robredo calls on the private sector to join them in their program and post job vacancies at the website. Businesses who want to post job vacancies can email details to bayanihanapbuhay@ovp.gov.ph. The OVP also plans to add an online portal for small merchants and an online skills training for job seekers. According to VP Robredo, their invitation for partners continues. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
The Education Department's budget request for 2021 has been cut by almost half, but DepEd lawmakers would increase its budget. Ray Pelayo tells us why.
DepEd has the second highest proposed 2021 budget with 605 billion pesos, but this amount was trimmed from its 1.1 trillion peso originally requested budget from the Department of Budget and Management. Education Secretary Leonor Briones explained their budget will not only address the situation of education during the pandemic but also in the future. DepEd notes there is no budget for teachers' internet allowance as the printing of materials must be prioritized. DepEd is hoping the local governments and the private sector would extend their support through the Brigada Eskwela. The proposed budget include 20 billion pesos for printed materials.
Even the requirement for the modules is not met. So ibig sabihin, pinaka-priority po namin yung modules ay hindi kaya ng ating funding availability right now.
Secretary Leonor Briones warns scrupulous individuals who ask for money from local officials.
The only way to stop this practice is to inform us, and we will take the necessary actions. No cash donations, please. No bank accounts, please. And if you make donations, we prefer material donations. We will not tolerate that kind of practice. Hindi yan pwede, hindi pwede sa DepEd, hindi din yan pwede sa Presidente, yung ganong klaseng practice.
As of September 15, more than 24.4 million students have enrolled in public schools. That's 98.8% of the numbers last year, while 2.082 million learners have enrolled in private schools, comprising about 48% of last year's private school enrollment. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Commission on Human Rights, or CHR, presented today before senators its proposed 2021 national budget. The Commission says it initially requested 1.4 billion pesos, but only 860 million pesos was approved by the Department of Budget and Management, or DBM. CHR Chairperson Chito Gascon said this may affect the operations of the Commission, noting that they only have a few officers working in regions.
Nangyayari po yung mga violations, human rights violations, sa mga lugar na malayo po dito. So by the time it comes to us, as we need to mobilize, kung mako-constrain yung operations expenses po namin, may impact sa ability to respond quicker. We will still respond, but mayroong impact po.
Gascon also took note that there are 165 vacant positions in the Commission and that they are in need of lawyers and investigators. According to Gascon, applicants tend to accept positions in other government agencies that offer higher salaries, such as the Department of Justice and the Office of the Solicitor General. For his part, Senator Ronald De La Rosa suggested to the CHR to hire investigators who are pro-police and pro-military.
Sana huwag nyo i-limit yung recruitment ninyo. Baka may unwritten qualifications kayo dyan na dapat yung papasok sa CHR ay hindi pro-government, hindi pro-military, hindi pro-police. Gusto ko lang mag-advise sa inyo na mag-recruit rin kayo ng mga pro-military, pro-police. Dahil para yung madali makapasok doon sa mga kampo pag nag-conduct na investigation.
We wish to reassure you po that in our selection and promotion process po, no political affiliation is ever considered. We just focus on the qualification standards. So we are looking forward to continuing and deepening our partnerships with all agencies in the executive department for purposes of ensuring that accountability for violators will occur.
Senator De La Rosa, whose Oplan-Tokhang during his stint as the PNP chief had been a subject of CHR investigations, pledged its support for the CHR's budget.
Alam kong sila ay very much worried na baka haharangin ko yung kanilang budget. Ako po ay lantarang sasabihin ko sa inyo na I am fully supporting your budget. Kung gusto nyo dagdagan yan, ay suporta pa rin ako.
Now, here's a glimpse of what's the weather like in parts of the country. A low-pressure area, or LPA, continues to affect parts of the country. State Weather Bureau Pagasa says as of 3 p.m. today, the LPA was located 75 kilometers north-northwest of Coron, Palawan. This LPA and the southwest monsoon, or hanging habagat, will cause cloudy skies with scattered rain showers and thunderstorms over Metro Manila, Ilocos Region, Cordillera Administrative Region, Central Luzon, Bicol Region, Calabarzon, Mimaropa, Visayas and Mindanao, and the provinces of Quirino, Nueva Vizcaya, and Isabela. Meanwhile, the rest of Luzon will experience partly cloudy to cloudy skies with isolated rain showers due to localized thunderstorms. Possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued. The Manila City government prioritizes free testing for COVID-19 among vendors of 17 marketplaces in the city. Drivers of public vehicles in Manila will follow in the mass testing for COVID-19. Let's find out why from Asher Cadapan Jr.
Manila Mayor Francisco Isko Moreno Dumagoso directed local government agencies to conduct COVID-19 testing among all vendors of 17 marketplaces in the city. He explained that the said mass testing will help ensure the safety of both the vendors and the market goers against COVID-19.
Binigyan na natin sila ng mask, tama mali. Binigyan na natin sila ng shield, tama mali.
Okay. Pero hindi natin alam anong ginawa nila bago pumunta sa palengke para magtinda. Tama mali? Okay. Now, we test them. And at least we can guarantee the people that all those who are selling inside our market are safe individual.
Mayor Dumagoso guarantees that the real-time reverse transcription polymerase chain reaction or RT-PCR test for market vendors will be free of any charge. The mass testing will be done on the opening day of the second RT-PCR molecular laboratory in Santa Ana Hospital in 2 weeks. The Manila government also plans to provide free RT-PCR testing on workers of other industries and sectors considered as exposed or vulnerable to COVID-19. These include drivers of jeepneys, tricycles, and pedicab, among others. The mass testing for these sectors will ease the worries of the public, which would also contribute to the recovery of the economy. In Taguig City, the vulnerable sector is well taken care of. This includes senior citizens, persons with disabilities, farmers, and fisher folks in Laguna de Bay. Aside from the aid that the local government of Taguig provides to every family in the city, the vulnerable sector receives relief and emergency allowance to help them get by amid the crisis brought about by the pandemic. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Today, Foreign Affairs Secretary Toyadi Locsin Jr. and Japanese Ambassador Haneda Koji exchanged diplomatic notes at the DFA as Japan extends a loan to support early recovery after natural and health-related disasters. The 50 billion Japanese yen post-disaster standby loan phase 2 aims to help the Philippines to better manage its vulnerability to natural disasters, to combat the coronavirus pandemic, and to mitigate the negative effects on the country's economy. The standby loan will also support technical cooperation projects that will strengthen the Philippines' policy and institutional framework for disaster risk reduction and management and public health emergency preparedness, among others. This is the latest support package Japan has extended to assist the Philippines and the larger Asian or ASEAN region in recovery from the impacts of COVID-19. In July, the two countries also exchanged notes on the COVID-19 crisis response emergency support loan.
The U.S. Department of State has temporarily extended the expiration period requirement for interview waivers from within 12 months to 24 months. This policy is in effect until December 31 this year. According to the U.S. Embassy in the Philippines, the measure is applicable for applicants who are renewing their non-immigrant visa in the same classification. For more information on the interview waiver process, just visit the website cdn.ustraveldocs.com/ph.
And for the news abroad, here's Kath Dumaraos reporting live from Bangkok, Thailand.
Economies across developing Asia will contract this year for the first time in nearly 6 decades, but recovery will resume next year, according to a report released by the Asian Development Bank today. The Asian Development Outlook, or ADO 2020, update forecasts negative 0.7% gross domestic product growth for developing Asia this year. ADB says this would mark developing Asia's first negative economic growth since the early 1960s. According to ADB chief economist Yasuyuki Sawada, most economies in the Asia and Pacific region can expect a difficult growth path for the rest of 2020. He added the economic threat posed by the COVID-19 pandemic remains potent, as extended first waves or recurring outbreaks could prompt further containment measures. However, growth will rally to 6.8 in 2021, in part because growth will be measured relative to a weak 2020. Thailand faced a shortage of personal protective equipment or PPE coveralls during the peak period of the COVID-19 outbreak in March and April due to high global demand. To solve shortages of protection coveralls for medical workers, HSBC Thailand and its allies launched a corporate social responsibility scheme for their project called Separate Pet Bottle to help doctors, which kicked off in June. They invited more than 400 staff to donate drinking water plastic bottles that could be turned into high-quality yarn to produce the coveralls. Krista Pacharoen, head of commercial banking, HSBC Thailand, said that when the issue of environmental sustainability and the COVID-19 situation was blended well together, it produced an amazing outcome for helping those hardworking medical staff. HSBC collected a total of 11,275 PET bottles and handed them over to Indorama Ventures to produce the recycled yarn, making more than 650 recycled PPE, which had been delivered to more than 200 hospitals since last month. With better yarn quality, the coveralls can be washed more than 50 times compared to 20 times with other garments. PPE coveralls from 100% recycled PET bottles have also passed laboratory tests conducted under international standards. The city and county of Honolulu, Hawaii hit its target for what the government calls free surge testing. Meanwhile, according to Mayor Kirk Caldwell, contact tracing efforts will reach the Filipino-American community in Honolulu. Judith Añufuente will give the details why.
September 14 was the last day of the free surge testing for COVID-19 in Honolulu, Hawaii, in partnership with state and federal partners. 60,274 people were tested during a 14-day period. As of Sunday, 266 results came back positive. This is a 0.6% positivity rate welcomed by the local government.
We just want to know where that virus is, and we know that the spread, while it is in different parts of our community, is not spread evenly throughout our entire community.
The tests are free and done by a self-administered nasal swab under the supervision of trained medical volunteers. The federal government has offered Oahu 90,000 tests due to surging COVID-19 cases. Meanwhile, Mayor Caldwell also revealed that his government is beefing up its contracts with 7 testing centers, as well as modifying those deals to include contract tracing.
So we really want to amplify what our community health centers are doing today and give them more tools to focus on the spiking cases in certain communities, like we talked about the Pacific Islander community, the Filipino American community. These community health centers are in these communities, and I think they can do a better job of finding where the virus is.
Judith Añufuente, UNTV News and Rescue. We serve the people, we give glory to God.
And in the UK, Prime Minister Boris Johnson reports that more than 4,300 have joined the police. Also, more than 100,000 people have applied to be part of the UK police. Johnson says this is part of delivering on the government's promise to recruit 20,000 officers to make the streets safer. And those are the reasons behind the news here in Thailand and other parts of the globe. Back to you, Harleen.
Thank you, Kath Damaraos, reporting live from Bangkok, Thailand. A Philippine serpent eagle, or Spilornis holospilus, was saved from distress in Tacurong City, Sultan Kudarat Province on Sunday. Jorly Dedelis said the wild bird was fighting a big snake at Purok Nara, Barangay Lancheta before the rescue. An initial report says that the Philippine serpent eagle is under the custody of DNR Region 12 Wildlife Rescue Center in Lutayan, Sultan Kudarat, though it has not yet undergone a formal medical checkup. The Sultan Kudarat State University Lutayan campus in-house veterinarian has said the raptor is in good condition. The Philippine serpent eagle is categorized as a species of least concern by BirdLife International.
And those are the reasons behind the news, September 15, 2020. I am Mariela Toza, sitting in for Angelo Castro III.
Reasons we deliver to you as they unfold. I am Marvy Delfin, sitting in for William Theo.
Because we need to know, we will always ask why. I am Harleen Delgado. We serve the people, we give glory to God.